So I've been given 10 minutes to go through quite a number of cases, so I'll rattle through these. I'll start with the obligatory overview slide. We've only had SPECT hybrid imaging at Canterbury for a couple of years now, just over 2 years. And during that time we've developed quite a newfound love of these colloid scans. In fact, the first case we did at all in hybrid scintigraphy was one of these colloid cases you'll see today. So splenosis is when there's misplaced tissue auto-transplanted somewhere else, and cells from a damaged spleen seed elsewhere grow into nodules, which can be painful or not. One of these nodules is called a splenule, or quite often called a splenunculus. Strictly speaking, a splenunculus has to be fed from a splenic artery, but a lot of people don't follow that convention, and I'm certainly not going to, because I really enjoy saying the word splenunculus, and I hope you like listening to it, because I'm going to be saying it quite a lot in the next 7 minutes. How do we image a splenunculus? It's quite simple. We image with technique labeled nanocolloid, which is avidly taken up by splenic tissue, and that's whether it's a native spleen or a splenunculus. Said one already. Okay, so let's see some images. Here's our first case. This is a fairly typical referral. We've got a CT scan with a pancreatic tail lesion. Now the initial suspicion was neuroendocrine tumour. You can see I've said it's octreotide negative. And they've gone on for MRI, and the lesion looks similar to the spleen, so we image with nanocolloid, and we'll do SPECT CT about half an hour after 200 megabecquerels IV injection through the splenunculus. And here's the CT. There's what does it look like with the SPECT CT fusion. So the arrow indicates uptake of nanocolloid. We might see Harry again, spoiler. So case 2, we've got prior imaging of CTPA, and I hope no one brought a swear box to that sort of thing. Splenunculus at tail of pancreas. Well, we'll see by injecting nanocolloid and doing SPECT CT. Here's the CT scan. This is the lesion just here, indicated by the arrow, and the arrow indicates nanocolloid uptake. And no surprises, we're going to call this splenunculus. Next case, number 3. So this patient had prior imaging showing a lesion abutting the spleen, query splenunculus. And here's, we'll just skip straight to the fusion. Here's the fusion image. Here is a very small lesion with no nanocolloid uptake. No Harry this time, no evidence of splenunculus. This lesion is really small. This is actually even smaller than the original CT the patient had. But elsewhere on the image that I haven't demonstrated is a lesion that's actually grown since the last CT. So the diagnosis is probably adenocarcinoma spectrum. And this is backed up further by interval CT scanning a few months later. Case 4, this time the prior imaging is FDG PET, and this is another incidental finding. There's a left upper quadrant lesion. Query splenunculus, nanocolloid imaging. Here's the CT. I think we know what's coming. Uptake in the lesion just below the spleen there. Altogether, 1, 2, 3, splenunculus. Excellent, thank you very much. Made my day. So we've got some prior CT imaging again. Multiple lesions in the peritoneal cavity. Now the initial suspicion is lymphoma. However, this patient has a previous ruptured spleen. So can we rule out splenosis with our imaging? So here's the fusion view. You can see the liver on the right and the spleen on the left. This is a very large spleen, so this is splenomegaly, but there's no foci of lesions that have taken up nanocolloid. The CT continues to be suspicious for lymphoma. So we can do an FDG PET. Here's the FDG PET for completeness, and there are FDG avid lesions in the inguinal areas, and this nice little one in the left axilla. So we'll call that lymphoma. No Harry. So ultrasound and CT imaging, there's a mass near the spleen, nanocolloid imaging to rule out splenosis. Here's the CT scan, so there's the lesion. You can see it's very, very proximal to the spleen on our low quality CT. And this is a really, really nice case for people like us who are quite newcomers to hybrid imaging. Without the fusion, this would have actually been very difficult to resolve a lesion just below the spleen like this one. But it is there. We think it's in the separate lesion. So we're going to call this Harry's favourite, Splenoculus. So this one, we have to go way back to 1997. Some of the people in this room were even born then, but trauma and splenectomy 97, MR imaging 2013, and it was assumed to be a splenoculus on MR imaging. How dare they? The mass has been slowly increasing, is now 39 millimetres, so is this really a splenoculus? How could we possibly find out? Here's the lesion on the CT, here's the nanocolloid imaging. We can see a nice avid uptake. Again, 1, 2, 3, splenoculus. Thank you. Just a couple to go. This patient prior CT and MR imaging, pancreatic mass, post-splenectomy, unusual tail, so query splenoculus. So we'll skip straight to the fusion image. Here we can see hot liver, some uptake in the lesion. Anyone going to say anything either way? Splenoculus? No? We don't think so. So some uptake, but not avid enough to be splenoculus. So what could it be? Some of you in this room probably won't be old enough to know who he is, or what that is in his hand. For people grey enough as me, this means we've got to phone a friend, and the friend this time is good old FDG. So FDG PET scan, we've indicated the lesion uptake there. I've scaled it so the uptake's very similar, but that's just me scaling it. So it's not FDG avid, it's not nanocolloid avid, and literature search tells us this is probably a fibrous tumour, which is sort of benign. Okay, and this is actually the last one. Tri-CT and ultrasound imaging, intermittent abdominal pain. This was particularly in the left iliac fossa, traumatic splenectomy, query splenoculus. Straight to the money shot. Note the not enlarged. This is liver creep, so the liver has crept into the space left by the spleen. But we have actually identified 1, 2, 3, 4, 5 lesions here. So particularly nice was this one where the pain was. This is exactly where the lady's pain was. Go after 3. 1, 2, 3. Splenoculus. Well, splenonculi. So let's just wrap it up. The overview. Nanocolloid is the imaging agent of choice for splenosis. So there are other imaging agents available for nuclear medicine tests, but of course, nuclear medicine isn't just one test, it's many, many tests with different agents. So use nanocolloid for splenosis. And as technologists and radiographers, sometimes it's a bit boring when you get a scan with a negative result, but actually negative appearances are just as important in patient management. Thanks very much.